Hello, my name is David Roman, host of the Pandemic People podcast. Today is April 10th, 2020. I'm coming at you from Regina, Saskatchewan in Canada. This is my basement studio, Roman Empire Studios. And yeah, we're under quarantine, so I haven't really left in a long time besides to pick up a click and collect groceries. So this is episode 1. Why I made this podcast, I'll tell you a little bit about that. I was having conversations with people recently, and yeah, we're talking about the pandemic a lot, and I'm kind of getting tired of doing that in some ways. But then I found that having conversations with people one-on-one in a kind of a social setting and just talking about their life and how things are going was really therapeutic for me. And also I felt really important to kind of broaden my horizons and understand where other people are coming from. There's a lot of people in this world, and most people are being affected by this pandemic in some way or another. So I thought, why not start a podcast where I talk to people, get their perspective, learn a little bit about what they're going through, and see how it all differs, see how it all compares to each other, you know. And I'm sure we're going to find lots of things that are commonalities between each other, and maybe lots of things that are quite different. So one of the things I plan to do on this podcast is highlight something positive going on during this pandemic, whether it's a story, an individual, a group, fundraiser, whatever it is. So today I chose a group out of Montreal right here in Canada. I figured why not start in my home country first. They're called Mercy Meals Montreal. I'm going to have the information on the YouTube page here. You can go check out their GoFundMe. I'll have information on my podcast pages as well. So yeah, what this group is, it's a bunch of university students, third year university students from McGill, I believe, and they're raising money for hospitals to help feed medical workers in the hospital. Their goal is to provide at least one meal a day to different medical wards that are affected in teaching hospitals across the island of Montreal. And as their initiative expands, so will their goal. And currently their goal is $30,000. They're nearly there. They're just over $26,000 in. So go to the site, if you have some money to give, please do give it to them. They could really use it. Our medical professionals are out there doing a lot of work that nobody else can do. And really they're on the front lines of this pandemic, risking their health, risking their families. So any little bit we can do to make it easier for them, I think is really appreciated. Again, go check out that GoFundMe page. Give money if you got some. If you don't, stay inside, wash your hands, do all those things that you're being asked to do so you can make medical professionals have an easier job in the hospitals. And speaking of medical professionals, my guest who is about to come on now, Dr. Lisa Glass, is just that, a medical professional. I'm going to let her tell you a little bit about what she does, but let's get to the interview. All right, so I'm here with Dr. Lisa Glass from Regina, Saskatchewan. I'm not going to say too much about who you are and what you do. I kind of want you to do that. So maybe tell us about yourself and yeah.
Oh my goodness. Okay. So many. Where do I guess? Okay.
From the beginning.
From the beginning. I was born in this hospital. Well, it's funny. I work in healthcare, and I used to work at this hospital in Calgary, and people would be like, "Oh, where are you from?" I'm like, "Here." They're like, "Oh, I'm from India. I'm from Montreal, whatever. Where are you from?" "Oh, I'm from here." "Oh, yeah. Where were you born?" "Yeah, I was born here." "Oh, yeah, here in Calgary." "Yeah, but like here in this hospital. Like I was born
actually there.
Yeah, I was born here." So, yes, I'm from Calgary originally. I have a background in physics, so I have a PhD in astrophysics, and then I decided to be more gainfully employed. So then I ended up training to be a medical physicist. So that's what I do now. So I work at a cancer center, and medical physicists are in charge of the technical side of radiation therapy delivery. Right. So we zap people who have cancer with radiation. And so my job is to make sure that's done correctly and safely. And yeah, that's what I do. That's my job.
You're still zapping people who have cancer right now, hey?
We are still zapping people in the. So I'm trying to adjust my light so I look less ghoulish, but I don't even know.
No, that's fine. That's fine.
Maybe is that? Oh no, that's worse.
We're living in the apocalypse, so everybody's equally
more ghoulish.
Equally ghoulish, yeah.
Oh my God!
I actually shaved, so you're lucky I shaved for this. So.
Oh, thank you. That's so kind. I don't care if as long as whatever makes you feel.
Nobody cares. You can't smell me. That's the important part.
Yeah, so no, it turns out that people still have cancer, that the pandemic didn't cure it. And and it's a real challenge because the question is, at what point is it riskier to bring them into the clinic, right? Expose them potentially to COVID, versus not treating their disease. So definitely there is, and we've kind of taken our cue from other countries and other places what they've done, but generally, I mean, there's certain treatments that can be delayed.
Right.
And certain types of treatment that you'd say, well, we can bring your chance of recurrence down from 5% to 2% if you get radiation, but maybe it's not worth it in this context. There's a lot of those discussions going on, but there's some kinds of cancer that we treat that really just, they cannot wait. This is the only thing we can do for people. They're life-threatening. Like COVID's life-threatening too, but this is, we have some forms of cancer where really, if we don't treat it, like it's not going to be good. So we're still, I think here we're aiming for like a 75% capacity thing. So trying to cut back. But as far as I know, we're still actually getting pretty strong referrals. So I don't think we have cut back that much yet. So yeah, we're partying on in the midst of this. So it's pretty nuts. Yeah.
Yeah. And I know here, like in Saskatchewan, it sounds like there's been a reasonable percentage of our cases are actually the medical workers themselves too. So I was reading today, I think it was around 10% or somewhere in that range. So,
wow.
So, I mean, our numbers are still pretty low in Saskatchewan, but like, do you feel like have they made quite a few adjustments in just how you're doing your process then and how you're kind of treating patients?
Yeah, no, so I'm actually working from home.
Yeah. Oh, okay.
Which is, so
zapping from home? No.
We're zapping from home. I'm zapping from home. So of course, so people who actually have to be there to operate the machines are clearly not zapping from home. Yes. But there's a lot of, so we have a team of 5 physicists. And so we've decided that we need 2 people in the building and we can have 3 people working from home doing, there's a lot, like we have a lot of computer systems that we support, and a lot of what we do is on computers. Right. So I can sign in to work from home and I can do that portion of it. So what we're trying to do is normally we all just do everything, but we're trying to portion it out so that the stuff that has to be done in person is being done by the 2 people in the clinic, and the stuff doesn't have to be done in person or that can be done on computers, et cetera, is being done at home. So we're just kind of portioning it out that way. And so we have 2 staff who preferred to be in the clinic, right. Which worked out really well for us, except they want to take 1 day a week off. So we're all kind of, the 3 of us who are at home are rotating in once every other week. Yeah. So I haven't been in for a while, but in a couple weeks, I'm going to have to go in for once a week or once every other week. For me, it's a childcare thing.
Right. Yeah.
They shut down the schools. And what are you going to do? And so at first, when they first shut the schools down, I was able to find, and before they set up this work from home thing, I was able to find friends who were able to take Will for the day, or my son for the day. He's 8. But now I'm finding that nobody wants to take him, which is understandable. People don't want to take the risk. And so right now it's just like I really don't have a lot of options. So I'm at home, and that's what's going on.
Right. So I guess you kind of told us a little bit already about how your job changed during the pandemic. Mm-hmm. Maybe tell me a little bit about how your life has changed. I mean, I guess you're already starting that with saying you don't have childcare, right? So and school, and you moved, so you have boxes behind you.
Yeah, this
is a paid advertisement for U-Haul. So
oh my God.
So yeah, your professional life is very clearly changed because you're in the medical field. But how about your personal life? What's going on?
Yeah. So. I panic moved. You know how people panic bought toilet paper and whatever. Like
Okay.
So you're going to explain. So I've been dating this guy for like 3 years, and we decided a few months ago, hey, we're going to move in together.
Look at that.
Yeah, he's going to sell
in
his
the
house.
middle of a pandemic. That's
there was no pandemic. You'll recall this pandemic.
You just never know. It's life decisions happen when you're facing death outside your door. So you just no, just kidding.
So we and it's a really terrible housing market here. So we think the rest of it could take 6 months, whatever, a year to sell the house, like his house. I was renting an apartment, but he had a house. So whenever that happens, then we'll do this. So he sells his house in 24 hours.
Wow.
Yes, in early March. This was about 5 minutes before the pandemic really hit.
Oh, geez.
And so, we agree, okay, the new owners will have possession early May, and it'll be, we'll figure, we'll do this. And then it gets more and more pandemic-y. And
It's an official term.
and we're start panicking, like, oh my God, like we can't be like, if this is going to peak in, in May, we don't want movers coming and touching all our stuff, moving us. I don't even know if you're going to be able to get movers if this is happening. Like, this is a terrible idea. So we found the point was the plan was to buy a house together, but we just decided to just find something quickly. So we rented. So we're renting a house, and we were able to get a kind of a short-term lease on it. And then the plan is to maybe buy something, but who knows, like in the middle of this pandemic, who knows? But so it's been crazy because everyone on social media has been complaining how bored they are and how it's just so, and I'm just like, I'm so the opposite of bored, because things are insane at work, and then things are insane at home, and it was packing, and then moving, and even once we got movers, I wasn't totally finished packing my old place. Movers moved the big stuff, so then I still had to go back for another couple of weeks to finish packing and cleaning, and now it's unpacking here. So it's been insanity. It's been nonstop, and this pandemic has not been boring for me. So there's my story to you.
Yeah, no. Well, and like, I know people say it's been boring, but I kind of feel like it's been more anxiety ridden than boring.
I agree with you.
It's just like every element of our life is like, oh, what about this? What about that? Oh, I can't do that now.
And if I was going to be totally frank with you, I would say that, like, if you've ever been through a trauma, I went through a trauma about 4 years ago, and it was pretty upsetting. Yeah. And the first week when all this happened, like when they canceled school and was really becoming clear, like, oh, like this is happening.
It was crazy.
Yeah. And I was just, like you said, anxiety ridden, just constantly. And it was just, everyone was like, but it was like, I was forgetting things, and I had to be really careful to make sure I wasn't screwing things up, and, blah, blah, blah.
Right.
And I was like, oh my God, this is like when I experienced my trauma 4 years ago, except this isn't nearly so bad. So, and I kind of felt a lot better a lot sooner. But for me, as I've gone through something before, it was familiar, and I was able to identify it and then use some of the coping mechanisms and techniques that I've learned. And I'm a runner. I like to meditate. I even just a different perspective on life. And it's sort of helped. And it honestly, this is not, for me, is not as bad as what I've been through in the past. And it's also been kind of nice because everyone's going through it. So it's not like when you're going through something on your own, it's like, you feel like your whole world's changed and turned upside down, and everyone else is acting like it's, Tuesday, which it is for them, So this is in a way nice, because everyone, you can sort of reach out, and people are all going through it, which is kind of a sense of camaraderie, I guess.
Yeah. And that's an interesting point too, of like just thinking about the idea that often when you go through trauma, you kind of feel isolated in that trauma. And it's like, we all feel isolated at the same time right now. And that almost brings us together in a weird way.
Yeah.
You know what I mean? Like,
the thing is, everyone's experience through this has been different, like I have friends, like, white collar type jobs who, they're like trying to balance, two adults working at home and having kids and distracting them. And then that's how that's a real challenge for them. But in a way, those are the most fortunate people I know, because then I know people who've lost jobs. They either had to be there in person, or for the economic downturn was such that now they're not working. And so there's that stress. So that's a huge, issue for people. But then I know lots of people who are essential workers. They're, especially in healthcare, given how I work. And it's just hard. Like I said, I haven't been into the office or into the clinic for a few weeks, but it is like to be, it's actually, honestly, if you're a healthcare worker and you get home and you look at your social media and it's full of, oh, I'm so bored, this is so lame. It's really, it almost hurts you, because you're just like, you have no idea how lucky you are to be at home where you're safe and you don't have to feel like, the days where I don't have to go out, I'm so grateful. I'm just like, I don't have to, like, being at work is, because there's a lot of group, communal computers, you go down to a unit and you got to touch the same computer everyone else in the clinic has used. And it's just, and you can wipe things down, and you can hand sanitize every 40 seconds, but it's just, there's just a stress of being out, and then you're constantly hearing on the radio, everyone needs to stay home, everyone needs to isolate, don't go near other people. And you just spend all day around people, and touching things and being in healthcare environment. And I don't know that we've had to treat a lot of COVID positive cases, but it's just, and everything's different at my work. Like anybody who comes into the building has to be screened, has to be talked to by someone. This is patients and staff. Obviously it's kind of a skeleton staff right now. So only people, and so they're rotating people. So it's not nearly as many people as you normally have. And how to get a hold of people working from home is not 100% clear.
Right.
It's, the patients are scared. We can't let them bring, I think they're still allowed to bring one support person, but they can't bring too many. The waiting room chairs are all 2 meters apart. Like it's just weird. And everyone's, I don't know if you've been to a grocery store recently and everyone's just kind of anxious and people are a bit snarky. It's like that, but worse because you're in a healthcare environment and you got immunocompromised people around and the staff, the patients, I mean. So, the level of stress just having to go into work right now is definitely something that other people shouldn't take for granted. But I think everyone's perspective in this pandemic is what I was trying to say is different. And
sure. Yeah. And I think that's a big thing. Like I know with my family here every day, we kind of talk about our gratitude. That's like our thing we do every night. Mm-hmm. And that's one of the things, like we're really fortunate that we don't have to leave the house. I've been able to work at home and all that, but definitely we like realize it's like, that's not everybody's reality. I mean, anytime we go out in the car, which hasn't been very often, you see people out and you go, people are still out doing some things. And it's, some people are doing it needlessly as well. Not just people going to work, but yeah. It's, you're right. Everybody, I mean, that's one of the reasons why I want to do this show too, is, just to highlight the various perspectives that were going on, not just here, but in other countries. And, Saskatchewan, obviously our experience is going to be very different even than Toronto's, right? In terms
Absolutely. Well, we're like, I think one huge thing for us and our benefit for this particular outbreak is we don't really do much public transit. I mean, you can take the bus here, but most people drive everywhere. So if you're feeling really stir crazy, you could actually just get in your car and drive around and go whatever down in the back. As long as you don't go in anywhere, it's really actually fine. We have this idea of going, we haven't done it yet because we were sick, but just driving out to a grid road and going for a walk on a grid road because nobody's going to be out there. No one's been there. It's just like, you
could do that.
And we're not dependent on it. Like, whereas if you live in downtown Toronto, you need to take subway to get around because like, what are you going to do? You're not going to drive. Like, I mean, a lot of people don't even have a car.
My sister lives in a condo, kind of in York area, and it's like a huge condo. So your chances of not seeing anybody or not crossing paths is very low. Like she says, every time you try to get into the elevator, it's like kind of a stressful situation because it's like, who's been in this elevator? And we definitely our sparse population here makes for a very different experience than them, so.
Well, when I was cleaning up my condo, it just, every time I go in the elevator, like I actually, by the end of it, I just had this policy. If anyone else got on the elevator, I just got off. Like, I'll wait for the next one. Like I just was like, and I was honestly shocked that anyone would even think it was okay to get in an elevator with somebody right now. Because sometimes you get on the elevator and you can smell the person who was on there before. You can smell their perfume. You're like, well, I can smell their perfume if they were not, if somebody was sick in this elevator not long ago, if they were coughing, that would be in the air, like for sure. Like the ventilation in the elevator is not great. Like it's just, when I was moving, I couldn't just take the stairs. Like I had heavy stuff. Like it was just going to my apartment was stressful. Like it was, I wanted to roll in hand sanitizer when I got up to the suite.
Just find pure alcohol and just bathe in it. No. So did you moved into a house, you said then, right? So
now we're in a house, which is part of that. The nice thing about that is that it's, you're not sharing communal spaces like you are in an apartment building or something like that. So that was kind of another part of the motivation for panic moving. So
right. Get ahead of it too. Because I mean, who knows where it's going? Well, I honestly think that Regina so far, based on what we're seeing, is not going to blow up the way other places have, but it's going to be here. It's going to be a problem.
Well, the SHA put out the Saskatchewan Health Authority put out their models that said the best case scenario they're expecting is over 3,000 deaths in the province. Deaths in the province, not like they're expecting like 20%. 30% of people to get infected at least, which I think is actually right. Like when a cold goes around, or or if you had influenza going around without people being able to get a vaccine for it, a third of people or something would get whatever's going around. It just the thing, and fortunately, for most people, it's not life threatening.
Yes.
But the problem is that such a high, like a relatively high percentage of people need medical intervention. And I think we all none of us know if it's going to be us or someone we love who needs that intervention. And my fear is that, you go to the hospital and you're with your loved one and there's they can't treat them. Like that's terrifying. And so we can't have that. Like to me, that's why it's so important to be doing all the physical distancing that we're supposed to be doing, is because you don't know who it's going to affect. And we all know people who are potentially vulnerable. It's just terrifying to think that a person wouldn't be able to get help when they need it because our system's overwhelmed.
Yeah. Or even the other side of it too, that you wouldn't be able to go there with them and support them,
That's already the case.
Right.
That's already the case. They're not letting anybody but quote unquote essential visitors into the hospital. So, it's a horrifying disease. I mean, if you hear doctors that are interviewed in Italy and stuff, like the worst thing about it, or one of the worst things about it, is just people dying or suffering alone, because they're trying to let them Skype with their loved ones, et cetera, but it's bad. It's scary.
Yeah, I made the mistake of watching a video from the Italian emergency room, and it was traumatizing. I mean, it was a while ago now, so I'm over it. But it was something I didn't really need to watch personally, because I kind of already knew what was going on. But there's people who definitely needed to see that to convince them.
I don't know if I watched the same video, but I watched a video that definitely left me shaken for days. And I don't mean to promote other podcasts on your podcast, but if you
this is hey right now, and it's Wild West on my podcast. I have nothing set up yet. If you listen to The Daily, which is the New York Times podcast, there's one from I think that's a good month and a half ago now, although it's hard to tell the passage of time. But anyways, they interviewed an Italian doctor. That one is really good to really kind of get a sense of, okay, I see, like this is what this means. This is what it's like. And I found that very helpful. Oh, good. Let's see. Okay, you've answered a lot of my questions already, so it's good. I'm trying to be all professional here. I have like a tablet in front of me with questions, like pretending I'm a podcaster.
You're so organized.
I'm. For those of you who are listening, Lisa and I have been on other podcasts before together, and sometimes they were not this organized.
No, but we were always having fun.
No, they were good. They were good. No. Well, it's hard to keep things on track when you have multiple people too. Like when you only have two, it's like you're just having a discussion. So and really, like I have questions for this podcast, but really ultimately I'm hoping it just turns into discussions and just kind of flows a bit, right? So
I'll be really interested to hear your other interviews and see like what other people are going through in other places. Like in the States, if you interview anybody in the States, in Canada, we have the stress not only of potentially catching this and overwhelming our healthcare system, and everyone's lives are changed. Their kids are out of school, work has changed, or you're unemployed or whatever. But in the States, not only that, but they also have to worry if they get sick. Now they might not have health insurance coverage because say they've lost their job, or maybe somebody's underinsured, or maybe even though you were fully insured, you still pay a certain portion, or you pay they call them co-pays, et cetera. It still could cost you an arm and a leg. It's just the system then there is the for-profit healthcare system is such that a pandemic like this is just, I just can't even imagine having to face that right now.
It's just, I mean, they're not set up to handle anything like this. Like honestly, like all the countries that are doing the best are the ones that have had more centralized control, I think, over healthcare, right? Like, well, maybe that's not even true, to be honest. I don't know what's.
I mean, look at like South Korea. I think is a good
example.
Classic example to contrast, because I guess they had their first not official case, but their first official detection on the same date in late January as the United States did. And they've had, talk about flattening the curve. They've had I think a few hundred deaths or something, and the States is ready to pass 20,000.
Oh my gosh, I can't even.
Here. It's insane. Like they're doing much, even population wise compared to Canada, they're doing worse.
Terribly worse.
They're really having issues there. But anyways, I believe what happened in South Korea, my understanding is that they just implemented the system. So people say, well, what testing? Oh, we should have more testing. Well, so people I think inherently think testing is a good thing because you want to know, do I have it or not? But the actual reason that testing is good is because it allows authorities to track who has it.
Yes.
So like let's say you get tested and you're positive, now they go and trace where you got it. And so if they can figure out where every case came from, then they can isolate people. And then so that's what they did in South Korea. That's my understanding, is they just did millions and millions of tests. Like they did it like drive-through testing. Like literally people would drive in, they would swab them, and that kind of thing. And so they did so many tests that they were able to figure out who had it, who got it from where, and then they could they could deal with it and they contain it that way. So, but that only works when your cases are small enough. Once you've had enough cases, you actually just can't do that anymore. So
it's just too exhausting.
Yeah. So that's my understanding of how they were really able to control this so well. Is like the social distancing we're all doing, yes, but is the tracing that they were able to do. And I think they're doing this in, I want to say Iceland and some other smaller communities in Europe, or smaller countries in Europe are doing this as well.
Even our testing here in Saskatchewan, I guess per capita has been pretty high too.
Yeah,
for what it is. Yeah.
If you look at the numbers, I think we have a few hundred cases in Saskatchewan, and there's only like 40 or so where they don't know specifically how that person caught it. It's most cases they're like, oh, you got it from that snowmobile rally or whatever it was.
The snowmobile rally, the bonspiel.
That's not a joke, but you're laughing, but just for your listeners so they're aware, like and here in Saskatchewan, we love curling and we love snowmobiling, and we've had a huge, like tens of cases, like a large fraction of our total caseload has come from curling bonspiels, which is a curling game. A gathering
of curlers.
Yes. And then, and also like a snowmobile rally / dinner thing that happened. Yeah. So it's actually true.
Well, and the sad part about the bonspiel is they were like trying to take precautions at that bonspiel to avoid spreading it as well.
Were they?
Yeah, they were like cleaning rocks and distancing and doing all that stuff. And it didn't matter. A bunch of people got sick anyway. So,
yeah, I mean, the whole thing with this thing is that it really is about physical proximity.
Yeah.
Like everyone is losing their, like wearing, my big bitch lately, or beef, sorry, I don't know.
Oh no, I don't know if we can swear on this podcast.
I don't know if we can swear on this podcast.
Is it for adults? I haven't made that decision yet. Anyway.
Okay, well, my beef is the glove wearing right now that I see everywhere.
Yeah, I saw
especially as healthcare. Oh, it grosses me out. Like all the grocery store workers wearing gloves. Like, so a guy coming.
Oh, they are.
They're all wearing gloves. And
I haven't been in one.
And of course, you're not going to take off your gloves between every customer. You can't. I mean, you can't take. I mean, you just. And I don't think it's just individual workers. I think it's the store giving them out to their staff,
right?
With good intentions. But it's like the guy who comes through before me, right, is sick, and he's handled all his groceries, putting them in the cart and coughing on them, whatever. And so now the person handling them all touches them with their gloves, and they don't clean or change their gloves for the next 18 customers, right?
Right.
So it's just, and people, if you don't have training for, you touch your face, you touch your nose,
yeah,
and it's gloves really give you a false sense of security, and unless you have open sores on your hand or something, it's much, much, much better to just wash your hands once you're done.
You'd have to be changing your gloves constantly, and it's just like it'd be ridiculous, In
a healthcare environment, what you're supposed to do, what we do, is you wash your hands, usually hand sanitizer, you put on gloves, and you deal with one patient, you take off those gloves,
take them off
properly,
yeah.
hand sanitize again, because you can contaminate your hands when you take them off because you're touching your gloves, and then another pair of gloves for the next patient. That's how it is. That's the only way to do it. That's the only way gloves are helpful. I mean, and you mainly have that so that you don't get like blood or fluids or things like that on your, I mean, if you're just going to be examining a patient and there's no actual bodily fluids or, nastiness involved, like hand sanitizing between patients is fine. Like your family doctor, whatever, can hand sanitize between patients, no problem, or hand wash. It's only if we're dealing with something where we get something visible on our hands, then you don't want to have to be, you can't hand sanitize away blood or mucus or whatever on your hand. Like that's
right.
Yeah. So anyways, but the glove thing is really a bitch that I have. Like I'm just losing my shit with everyone. I'm just like, just wash your hands, everyone.
Well, exactly. Or like you got to be careful. I just think the gloves thing, it's kind of silly, right? Because you're just sitting there collecting germs and. Yeah.
I guess if you're just used to working in healthcare, a lot of the things you see are just, people have good intentions, but it's just silly.
Yeah.
Like, if you go, I haven't gone in weeks and weeks, but last time I went to Costco, you had to go in through this kind of long, like cattle thing. Like it was like a long, they were letting people in, but you had to like go through this long, kind of like an amusement park. You had to like go through this, whatever.
Yeah, the big fair ride.
Or like at the bank, same thing. So before you go in, you grab your cart. So you're touching the cart that the other person before you touched, and it's dirty, or it's contaminated, right? So you're getting it on your hands. So you walk up, and then just before they let you into Costco, this guy would spray your cart and wipe it down and say, okay, go ahead. But meanwhile, your contaminated hands go back on the cart, and then you stick down, and then you just it hasn't done anything. And you just kind of see that kind of goofy stuff that you're just like, all right, guys, I can see that it's making you all feel better, but it's not really doing
Oh,
it.
yeah. No, like that's just it. Yeah. Contamination of hands is like such a touchy thing. Like you have to be so careful with every little action you do, right? Like
you just have to wash your hands
Yeah.
a lot. I mean, that's really,
Yeah.
and the thing is,
don't touch your face.
Yes. And they're just saying that honestly, the contact stuff is probably not the way that most people are getting this. Most people are getting it by breathing the same air as somebody who's sick.
By talking moistly.
By talking moistly, which is amazing. It's going to be,
For those people who don't know, our prime minister said that. So
Justin Trudeau said that he was trying to explain to people that people should wear face masks, and then he said, so he was kind of flustered. He was like, so you can, talking, like talking moistly to people.
Talking
like,
moistly.
Oh, that's a horrible picture.
Like the sign language people, the sign language people in the corner kind of like
I don't know how to say that. And then now there's videos, and did you hear the auto-tune version of that?
Yes, I did. Yeah. I should almost link that in my show notes.
I recommend it, but we knew what he meant. But yeah, I mean, and then the mask thing is another thing. I think people are wearing masks thinking it's protecting them.
No, and it's not. No.
But the reason that they're recommending people wear masks in public is because it actually protects other people. So if you're sick,
exactly.
So you can contain it around your face, okay? And then, but once you've sprayed your germs out into the air, it's not like there's holes in the sides of masks and stuff. It's unless you're wearing an N95 mask, it's not gonna.
That's why if we had like 100% mask compliance, it would make a difference. Because then everybody would be not spreading it to each other.
Exactly, and so it's a beautiful thing. Wear a mask. I think it's awesome, or wear a scarf or whatever. I think it's a beautiful way to show your love for your fellow human beings and that you're around. Like it's great, but it's not helping. It's not protecting you. It's protecting others from you. So.
Oh yeah, no, and I know like. It's not really necessarily a selfish interest, but it's just people are obviously thinking like, how do I not get it? But you're right. Like it should be more about thinking about, hey, I might to be infected and I don't know, so I better stop other people from getting infected.
It might kind of help you, but probably not. The best thing to help you is to do what you're doing and just don't go out. Like I'm almost embarrassed to say that I've gone to grocery stores. I mean, like I don't know.
You have to though sometimes, right?
Well, and if you're organized, you can order it online and go pick it up, without going in the store. They have it delivered, but like sometimes it takes so long to because everyone's doing it now, which is great. But now, sometimes you can't wait 4 days for bread. So
we've been doing nothing but click and collect, but it's been like a lot of planning, and then like we run out of things. Or we have to wait a little bit longer, and then we're like eating the weirdest meals. But it's like, I don't know. I'm so paranoid that's. I'm like, I don't even care. I'm like, if I don't have my fruit today, I'm like, whatever. I'll wait a couple days or things like that, right? So
it's okay. It's. I think that's a great way to. I don't know. We should all be doing that. I mean, I feel like if you've ever been broke, once in a while, you're just like, what am I doing? I'm so stressed about going to the grocery store this weekend. How am I going to be able to afford it? Let's just play this game of how long can I live off what I already got? And, and you figure it out. And sometimes you can, if you're ever trying to make ends meet, you can actually do it that way just by being like, I'll just stretch whatever those beans that I haven't been eating in the back of the pantry.
Like there was one day we had like cabbage and mushrooms with some canned tuna and like you just have to. You're right. Like it does. If I feel like I'm a college student. Trying to live off a limited budget, which is fine. Like that's great. And actually the amount of money we're accumulating because of we're not spending anything is great. Like I think when this is all over, we'll be financially sound. So,
that's occurred to me. Like, I mean, obviously a lot of people have lost their jobs or have lost income or whatever. So, I mean, some people might need to, but I wonder if as in general, we're all going to learn a lesson here. And like, maybe you don't need to go and do something every damn Saturday night. Maybe you don't need to go spend $100 at the bar. Or you don't need to take a trip every single long weekend or whatever, whatever it may be. Like it's, I don't know. It's kind of, a lot of people have said one silver lining is it's nice to get connected to family again. And for me, I haven't felt that yet because I've just been moving. But
I was going to say, you're still like in process there. Like I can see your boxes and it's,
I've done, this was a lot worse earlier today. I swear to you, there was something that it's,
Well, I moved about a year ago and I'm still going through things. So it looks pretty good here,
that makes me feel so much better.
Right.
Thank you.
Right.
Because I'm like, at this rate, it's going to be a while. Like it's going to be.
No, there's still little piles upstairs and in my garage and things where I'm like, I don't know what I'm doing with that thing. And
Yeah. Well, and when you don't need to get dressed for work, or you know what I mean?
Yeah.
Like you don't need a lot of your stuff. It's just like, oh man, like I don't think I'll ever unpack whatever.
Yeah, it's like I got a year of a pandemic yet to unpack. I'll wait. Yeah. 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 So we're gonna do something kind of fun and silly now, if you're cool with that.
Okay.
So I have this very scientific, it's called the preparedness scale for a pandemic. It's very scientific. So you're going to get a score at the end of this based on how well you're doing.
Okay. You shouldn't do this to scientists. We're very type A. We don't like losing, right? Like
I'm going to use touchy-feely things because I'm a social scientist. No, I'm just kidding.
Dear. Bad.
No, I'm just kidding. It's not scientific, but it's fun.
Like I will tell you before you start that I'm actually enjoying the 2 meter thing. Like 6 feet for the I'm just like, because I'm naturally not wanting to get that close. I'm not wanting to get that close to any. That's a science thing. Anyway, sorry.
That's one of the questions here. So just wait. So
sorry.
Okay, no, this is cool. So, and you've already answered some of this kind of already, but so wearing a mask or not wearing a mask?
Wear it for the benefit of others.
Okay, deodorant or no deodorant?
You don't need to. I guess I do, but you don't need to. If you don't want to, don't.
You're going out in public, so.
You know what though? I mean, if you can smell me, you're closer than 2 meters. That's your fault.
Oh yeah, there you go. Actually, that's great. That's a great point. I mean, I think my smell might carry 2 meters, but I'm not sure. Shaving or no shaving? Are you shaving anything? Are you?
I am, but you don't have to. I don't think you ever have to.
Yeah, that's true.
It's always up to you.
You don't have to wear deodorant ever either.
Especially for women. A lot of these are like, I know women don't wear deodorant and they don't shave and they're like, fuck you, I don't. Oh, sorry, there we go. I guess you do have an explicit podcast.
Yeah, now I can't post this on kids' YouTube. That was my target demographic. Pants or no pants?
Sweatpants.
Sweatpants all day, yeah.
Jeans if you're feeling fancy.
Okay. Yeah, I've worn so many joggers, I can't even count. Like, that's pretty much all I wear. I'm just like, I don't need to get dressed up.
For the women, you should ask bra or no bra, because I'm betting a lot of bras are not being worn.
Actually, I don't think I had that on here because I didn't want to get too gender specific.
I'll let you know that bras are not being worn.
I can confirm. I can confirm my house is the same way. Yeah.
Fuck it. Why?
Well, why bother, right? What's the saddest pantry meal you've eaten so far?
Today, and this isn't, I don't know, I eat this even when it's not pandemic time, but I was like, oh, what am I going to have? And then I had this super spicy Korean noodle thing. It's like 99 cents per packet. And I was just and it's got freeze-dried, chives in it and stuff. And sometimes I'll add cut up, cube chicken from the fridge or vegetables. Right. And I didn't do any of that shit. I just poured hot water on it.
Was it any good or was it
freaking awesome?
It was good. Okay, good. That's good to hear.
Pulled out my chopsticks. It was beautiful.
What's your streaming service of choice and what's your recommendation on that service?
Streaming service? Oh, you mean, for people who have time to watch TV.
Yeah. Oh, yeah.
Okay, so I'm actually just show driven, right? So I've been watching Picard. I definitely watched the last 2 episodes, so don't tell me what happened. So you got to watch that on Crave. And,
so you're recommending Crave? Okay.
I don't know.
It only has 3 shows.
That's the thing, right? Amazon Prime has some amazing shows, but it's also got 90% shite.
So much garbage on there.
I mean,
in Canada anyway.
What would I say? If you got to only get one, I would just get Netflix. I would go for the basics. Sure. If you're feeling cheap, I would go with Amazon because you get the free shipping and you get the cloud, blah, blah, blah. And you get, it's like $80 a year. So, I mean, if you don't mind watching, action comedies from the early 90s, then and you don't care what it is, just get Prime.
The only thing with Amazon right now, it's a month wait for all your shipping now.
No
more 2-day guarantees.
Yeah, that's true, but it's still something.
Still something.
I don't know.
Yeah. Okay, I won't get off topic here. Let's see.
Sorry, I'm derailing.
What's the one thing you can't live without?
No. Oh man.
Besides family, don't think family. Think actual thing, an actual thing.
Yeah, every time I go to the store, which is not that frequently, or I make an order or whatever, I order extra chocolate. I'm just just in case, I can't run out, right? So there's and I'm not going to run out because I have so much now, but I have a fear of it, so I just keep buying it.
That's awesome. That's really cool. That's a decent comfort. That's not like it's not like, well, cocaine. I just can't run out of cocaine.
Yeah. Well, and I'm also, as you know, I'm also a knitter. And so I feel like all knitters have been preparing for this because we all buy way too much yarn all the time and more yarn than we could ever knit.
Right.
And so now we actually, it's like now we have a justification like, oh, I was just preparing for the pandemic, really. Like,
that's what I was doing all along.
Yeah.
I'm not
that's
weird.
why I needed, $30 skein of alpaca yarn.
Oh, you're not the only one. Like, actually, it's funny. One of my friends I've FaceTimed with regularly, like every time we're FaceTiming, she's using her knitting or whatever. So yeah. How full are your cupboards and fridge?
They are, well, okay. The ones that are unpacked are full.
Oh yes, because you're
I've
moving.
I've got boxes of food in the kitchen that I don't know exactly where to put them, and they're in the base. I've got so much food. Like I really I get nervous. Like I worry. So I buy way. I'm one of these people. Like I'm like, do I have butter? I don't know. I'll just get a butter just in case. And I get home like, oh, I have 8 butters. Okay. Like,
but hey, you need it.
You can freeze butter. So that's not so bad. But I do. I'm one of those where I buy I forget. I'm like, do I have to I didn't mean to hoard toilet paper, but I'm like, do I have it? I don't know. So then I buy it. Oh shit. I have to buy one. Whoops.
That's good. It's going to be currency eventually, toilet paper. So as we go. So, what's the best music to listen to during the apocalypse? What are you listening to?
You know what I'm listening to? I'm listening to the stuff from the 90s that's comforting to me. Like I'm listening to my Sarah McLachlan and my Dave Matthews Band and my Rage Against the Machine. And I'm listening to the stuff that I haven't listened to in years. And that I'm just like, it's making me comforted.
Awesome.
Yeah.
Well, we already went through that one. How do you wash your hands? Explain how to wash your hands.
Oh, well... Oh my God, I actually want to say, so there's videos online and you should watch them.
Sure.
I think the question is actually time. I think like if you haven't spent enough time washing your hands, you haven't done it right. So it's at least 20 seconds. Mm-hmm. And so people say, oh, you can sing happy birthday twice, but you could also say space, the final frontier. These are the voyages of the starship. Et cetera, et cetera. Or you could do the whole intro to Star Trek: The Next Generation. Yeah. And so you want to do your hands, the front of your hands. You want to do the backs between the fingers, this way. Mm-hmm. Your thumbs are often missed, And you know what else is missed is your nails. So if you go in and get into each nail, and and just make sure. So you want the because the way that soap works is if it's mechanical. So yeah, get the soap everywhere. Take your time. Do your wrists a little bit. Like my watch, yes. I'm so glad it's washable. So I can actually just take it off and wash it, but take it off before you get fully lathered and then rinse thoroughly. And so it's the time really that's the thing. And so once you have enough time, you get bored of just rubbing the fronts. So now you do the backs and you do the middles and the sides. And honestly, people, long fingernails are so gross. Like they collect bacteria. So if there's any, and you can't go to your manicurist right now anyway. So just cut them off. Cut them off for now.
Geez, I had the wrong guest on. First, I wanted somebody to tell me a really bad way of washing. And it's going to happen. One of my future guests is going to tell me something. No, we have you have the medical, and I didn't even thought about that. Like the medical process of doing it. That's great. No, I haven't heard about the nails. I never even thought about that. Like I obviously have watched my nails before, but it's something I should do every time is be really cognizant of that. So that just added to my knowledge. So I appreciate that.
I just, as you know, as healthcare worker, I'm actually not allowed to have nails that are longer than the end of my finger tip. And if you ever have, I've gone to an ER before, in a different province, and the nurse had super, super long fake nails, and it absolutely made me want to barf. And it's not allowed. She shouldn't have had them, but anyways, it's gross.
No, it makes sense. Okay, I know the answer to this already, but hugs or no hugs?
Well, for the people you live with, hugs.
Sure.
For your pets, hugs. Everyone else, no hugs.
And when this is all over, do you think you're going to go back to shaking anyone's hand?
Oh, I never liked it. I'm one of these people. I've never liked that. I've never, I love to hug people that I care about, but I don't like to hug everyone. I don't. The other day I was at the car, or not, I don't know, it was a month ago now, I was at the hardware store being I want this, on my phone. I was showing the guy and he reaches for my phone to try to zoom in to pinch in and see it. And I'm just don't touch my phone. And it was like, oh yeah, sorry. But in the pandemic, you can say that. And I wish that was true all the time. Don't touch my phone. Don't ask me to pass you my phone so you can scan the card on. go away. Like, don't touch my shit. Anyway.
Well, and I kind of feel like you're gonna be allowed to say that from now on. I think
So.
it's gonna be years probably before people are comfortable with general touching.
I'm not, but people are saying, like, I'm hearing people interview, they're like, oh, I can't wait I just want to hug everyone.
Yes.
I'm just like, no, I do not feel that way. Like, I have never felt that way. So.
No, I 100% hear you on that. Like, I'm just thinking about like the day that they let people back out into the community, and then like 2 weeks later there'll be a second outbreak because everybody's hugging and touching, and it's just going to be like, yeah.
It's not my thing.
So the last question on my official scale, what's your pro tip for survival? What's like the biggest tip you can give people?
For survival of this pandemic, or if like things get like zombie apocalypse?
In general, just surviving. How do you survive? How do you survive any kind of trauma like this or crisis or anything like that?
Yeah, so I think you need to figure out ways to cope in healthy ways. Okay. Right. So if you're drinking a lot, if you're doing a lot of drugs, if you're, starting fights with your spouse, if you're, you know what I mean? Like all the things you do that are like, that's all going to get exacerbated. Right. So you need to figure out healthy coping mechanisms, self-care things that, like, for me, meditation has been really useful. I think actually even more useful than that, because it's so instant, is exercise as a kind of healthy coping mechanism. Which I haven't been doing as much as I should have been doing recently, but like I do try to do it as much as I can.
You're lifting boxes all day, so that's
well,
good enough.
I mean, I'm a runner, so I'm lucky that I can keep doing my exercise of choice, and when even throughout this. So, but yeah, I just like to figure out the self-care things you can do that are healthy, and really be aware of the things you do to cope that are unhealthy, and try to nip those. Like if you tend to pour yourself an extra few glasses of wine at night when things are stressful, you have to recognize that's a coping mechanism that's not going to be working for you. Like, that's not a great way to be coping. I mean, I'm not saying any drinking at all is bad, but I'm just saying, like, if you're finding you're relying on things that are not healthy, or you got to recognize that stuff. So sorry, very serious answer to your question.
No, that's a perfect answer. Yeah. That's a really good answer. I feel like that's, some people are kind of making jokes about like, oh, I can't live without this crutch during the apocalypse or kind of thing. And I almost feel like your answer is a little more like on point for me anyway. It's the idea that we need to find manageable ways to cope, right? Not like, oh, well, I need to like smoke all the weed possible now that we're, like that kind of thing. It's like,
if somebody wants to smoke a joint once in a while, guys say go nuts, right? But if you find that that's your, you can't get through the day with it. Like, I mean, you just got to be really aware of those, especially if that's, I don't know, I worry. My dad has been an NA for many, many years now. And they've actually been doing meetings, like virtual meetings. Like, I don't know if they're doing it on Zoom or Skype or whatever they're doing, but there are still virtual ways you can reach out if you need support that way. But, if you kind of lean on the unhealthy things, right, they might feel good in the moment, but you never feel good about it later. Whereas when you do the healthy things, you feel good about it later. And if you can keep up with it, then you really, I mean, it can't be like have a bath, read a book, go for a walk, whatever. I mean, like, it doesn't have to be like super like in-depth, whatever things, but just do things to blow off steam. You know what I find helps? Like, if you're really like, if you just can't get out of that mental, podcasts are great. And
there you go. Yes.
No, but really, like, I really do find that podcasts
true.
If you can't sleep, I just put on a podcast and then I fall asleep to listening to one I've heard before, say, for example, or if you just, if you find you can't, I'm one of these thinkers. So if you find you can't get out of that, I find that podcasts are a great thing, because you can take them almost anywhere and kind of go that way. Yeah.
Yeah, no, I feel you on that. I definitely stay up at night sometimes, not even thinking about the pandemic per se, just in regular, just in general. I'm like, just spinning at night, like thinking about things, So.
Well, and then even when something like this happens, you can have like this just general sense of unease all the time, even if you're not actively thinking about it. You can have like this, you're holding tension in your body, and
I'm definitely there.
So figure out stuff that helps you with that, like whatever works for you, but try to make sure that they're healthy things.
Yeah, cool. Okay, now we're going to end with some serious stuff. Not serious, but just a little more like, well, no, actually everything's been really profound so far. So,
I am, man. That's
no, it's good. No, we had some fun in that last section. Oh, and I didn't give you your mark. I give you an A+. I give you an A+ based on all that. No, you were
so good.
You were on top of everything. There was no I imagine some people are going to be like, well, I have to put deodorant on every day, or I have to, no, you had the right answers. It's like, when you're in the middle of this kind of crisis, you You just, well, not that this is a test, but
of all the things I'm going to worry about, whether people are wearing deodorant is not up there.
All right, things like that. Like, it's like, who cares? Like, just go braless, don't shave, don't stink. Who cares? Like, I don't
and take
care.
that out of the pandemic. Just do what you want to do.
Exactly. Right.
Whatever.
But it's like, like actually kind of just to close that off. Funny thing is, there was somebody who posted a picture in Weyburn from 7-Eleven of like, they have a sign posted on the Slurpee machine or on the Big Gulp machine or something about like COVID-19 and blah, blah, blah. And I just thought to myself, I'm like, if that's like your biggest thing during the pandemic, you need to still go to 7-Eleven and buy a Big Gulp. Like, I guess, to each their own, but I was just kind of like, you're not surviving this apocalypse if you can't live without a Big Gulp. It's just like,
I don't mean to derail you. I just want to point out that like sometimes we'll have patients in the cancer center who don't show up for their treatments, or we have to let's say they have 30 treatments. They have to come every day for 6 weeks, right? And we have to call them every time and remind them, and they don't always show up, and so it ends up taking 8 weeks and blah, blah, blah. And we always say to ourselves, we say to each other, for this patient, cancer is not their biggest problem, and that is. Can you imagine having that as your life and that being your thing? So, I mean, for some people, COVID is not even close to your biggest problem.
No.
So, if I don't know, if you need to go get your, I guess, to me that's disgusting right now. Like, I wouldn't even consider it. But like, I don't know.
I would just think from a logical standpoint, if I still want my pop, like maybe I should get it at the grocery store and click and collect it so that I don't have to walk into a disgusting 7-Eleven and do it.
Or you can, Yeah.
Or something like that. It's like, I'll pay the extra $1 to avoid one more contact of COVID. No. Actually, that was one of the first things, like in my neighborhood here, in the first week when everybody was isolating, there was like teenage kids coming down, because 7-Eleven isn't far from where I live. And there was like teenage kids coming together with their Slurpees and stuff. I'm like, oh my God, you guys, like, what are you doing? Like, just get home already. Like, I know you're young, but yeah. No. I was observing them from across the street though. Don't worry. It wasn't anywhere near them. So where do you think, and this is a big question, it's a loaded question, I guess, but where do you think we're going realistically as a society after this? Like what's going to change besides the obvious things like social distancing and stuff? Like what do we learn from this? What do we become now?
Okay. So this is going to sound very cynical, but
that's fine. Be cynical. Yeah.
I mean, I think this is going to be going on until we get a vaccine, which is what many experts and political leaders have said. So I think that, and maybe we won't be this level of social distancing for that period of time, but we may be able to kind of, let people go back to some things and then, but then ease up and then go back strict again. And that would probably be going on until we get a vaccine, probably take about 18 months at least. Once we have a vaccine, I think it's going to take a while, the economy to get back, people get back to work, blah, blah, blah. But my thoughts are within 5 years, this is just like a story people tell. Oh, remember when that happened? Yeah. And I doubt anything changes. There's still wet markets. There's still anti-vaxxers. There's still,
how can there be that?
Yeah, there's still political strife. And and everyone, because that's how it is. Like, SARS happened and then people were working on vaccines and then SARS was kind of petered out and they never finished doing a SARS vaccine. So we've never actually had a coronavirus vaccine. It's just, I'm just kind of cynical. I think it'll, as soon as people are back to or have a vaccine and they can't get this anymore, or to the point where, that half of people have gotten it and it just, it just doesn't, or everyone's gotten it at some point and it doesn't matter anymore. There will be some long-term economic repercussions from this. It'll take a while for the economy to recover, but in 5-10 years, it'll just be business as usual. I think it'll be business as usual as soon as it can be. People just like that. That's my guess.
America was supposed to open up Sunday, right? That was an Easter Sunday. Yeah. That's we were just gonna go back at it. No.
Start with So on the short to midterm, it's going to be this or rolling out in and out. But something our kids will talk about to their kids when they grow up. I missed school for 1.5 years when I was 8 years old, or they're gonna, but I think our kids are going to be okay. It's just, but I think long term, I don't know. I'm just cynical. I just don't know that. The Obama government was terrified of after the Ebola epidemic, and they started an infectious disease task force, and that was dismantled by the next government that came in, right? Yes, so I mean, like, that's just an example, but like, I just, people have been warning about infectious disease and pandemics for a long time, and yeah, it's just going to happen again. And the scary thing is this is really a dress rehearsal, because this is maybe like a 2% mortality rate from getting this, but bird flu can be like 60%, right?
Wow.
Like what?
Wow. Yeah.
Like
Yeah.
some forms of it. So I think it's probably nothing's going to change. I'm sorry.
Yeah. No, one thing I think might change in some countries anyway is universal basic income will be a thing. I think.
Yeah, this definitely. Well, it's funny because it went from no like very only fringe support for UBI to like Mitt Romney's like everyone should get $1,000.
Yeah, isn't that crazy how quickly?
Yeah. And maybe in the States, maybe they'll start thinking public health care. Maybe they'll be like, hey, actually everyone's health is interrelated, and it's not, it actually doesn't work to say only rich people can get the best access and poor people can't. Like it's just, and it's actually not even stratified that. I mean, I've oversimplified it here, but
well, for sure,
it's to the public good to have just like how we wouldn't say, well, have you paid your bill, or you can't get a firefighter out, or you can't get a police officer out, or you can't, no, we don't say that. So, and that's the same with healthcare. So, that's it. So, and maybe that, I think they already actually do have quite a lot of support for like for example, the Medicare for all and Bernie Sanders idea had quite a lot of widespread support in the States. And so even before this pandemic. So I think maybe that'll change.
That'd be nice to see that happen down there. I mean, obviously Bernie's dropped out of the presidential race at the time of this podcast, but I think if the people, you're definitely going to see enough people who've been impacted by somebody dying from this thing that in the States that
everyone's going to know someone down there, because it's so bad right now. Like I just don't think to get away from that, unfortunately. Like it's terrible.
And so I feel like, I think that could definitely make people really accept universal healthcare at that point, realizing that you need it in these kinds of things. So,
well, I don't even know if it's necessarily they don't have widespread public support so much as there's lobbyists and there's special interests. But I mean, at some point, if there's going to be a critical mass where it's just not going to be acceptable to not be for it. Yeah,
that's just it, right? So, I mean, having said that, right now Trump has a high approval rating somehow through all this. So who knows how smart the American people are going to be in the future? But anyways. So here's the two questions. The first one is, what's your biggest fear in the pandemic?
My biggest fear is somebody I love getting seriously ill and needing to be hospitalized, and me not being able to go visit them.
Right, for sure.
Or I guess, and then worse, for them to die alone in a hospital. If you wanted to talk about, that would truly be my big. I'm not really too worried about myself. I don't feel like I'm super high at risk, but I know, everyone knows people who are 60-year-old, or my parents are, or people with comorbidities or whatever. And it's just, that's my biggest fear for sure.
So then conversely, what gives you hope, or what's your biggest hope from this whole thing?
My biggest hope, I hope that they'll be able to develop a vaccine as soon as possible, or some other treatment method as soon as possible, to kind of make, because the sooner that happens, the less, I'm worried about the economic effects of this. I'm worried about people, the economy being in the tank and people not working, and people, I think it's just, it's average people and poor people who get most affected by this stuff. So it's, I know that I don't know that I guess I don't really think this is a great situation. There's some silver linings, but I think overall, what we want is a quick resolution to this as possible, and the only way to get that is through either a effective treatment method or a vaccine.
Well, I guess the good news from that is there's a lot of vaccines already being tested. So it's still going to take a lot of time, but
unfortunately, you can't really speed it up. It just takes out, hopefully one of those that started is going to work in the next 12 to 18 months. That's, I think that's but that's the time scale I think we're looking at.
Well, and I think the hopeful thing in that is that we've directed so many resources towards that around the world that it seems like we're taking it seriously is what I'm trying to say. It's not like it's not like we're going
But I don't think so it's time that's really the problem here. Right? The longer we do this, the more the economy tanks, the more that people God, I can't even imagine not going back to work for 18 months. And my kid not going back to school for 18 months. But that might be the reality, or only a little bit, or small amounts in that period of time. And I don't know, I think the longer this lasts, the worse it's going to be. So that I think the best hope I have is for this to be speedy. But like, I've heard an analogy, people who think that you can make a vaccine faster because you put more resources into it. It's like people who say that, 9 women could make a baby in 1 month. Well, no, it doesn't work that way. There's a certain amount of time that you need to have to do these clinical trials properly. You cannot get you can't just give healthy people a vaccine not knowing all the possible effects, and you can't just distribute that massively. So unfortunately, it just takes however long it takes, but I think we're racing against time. So I guess my hope is for this to be over as quickly as possible, but I think realistically it's going to be it's not going to be 5 years, but it's not going to be 6 months.
Yeah, it's not going to be July or August.
Well, they might
just get a break.
Yeah, they might give us breaks, but I think we're going to be dealing with this until there's a vaccine, or a good treatment method. But I don't. Yeah. But typically, preventing, like when it comes to like public health, preventing illness is the only really way you get any sort of meaningful result. Right. Dealing with illness once it's already gotten bad, once it's already there, treating it once it's become acute tends to not be the thing that has wide-reaching implications.
Yeah, no, for sure. No, I think I'm with you on that one. I think a vaccine is our best hope in the future. Obviously, I think that's.
So the faster, the better. But
yeah. So here's the big question to kind of end us off. Well, first of all, before I say that, I just want to say thank you for coming on and chatting with me. And
it's been so nice. I haven't talked to you in so long, Dave.
I know.
It's such a pleasure to talk to you, and I really appreciate you inviting me. And this is awesome because when you listen, you love a certain podcast, and you go back and listen to like the first few episodes, and they're a little bit different. They haven't quite found their groove. I'm glad to do that episode. I'm so excited.
Yeah, it's this is that episode. I mean, I think you're doing a great job. I don't think it's gonna come across pretty well, but yeah, no, I appreciate you coming on. I really wanted to kind of start at home here in Regina before we branched out to other people. And I felt like having somebody in the medical field who also has podcast experience was kind of a perfect fit for me. So
super flattered you asked me, even though I don't have a typical experience because of my panic move. But.
Yeah. Well, no. But I mean, like you're in the hospital, you're seeing what's happening there. Yeah. You're in touch with that side of it. Like I'm hoping to interview people in lots of different professions and different walks of life.
It's pretty hairy.
Yeah, so because I know I'm going to hear some really interesting things from people probably, and like, hey, I'm a business person in this state, and this is what's happening in my business now, or that kind of thing.
Sorry, just quickly, where I'm getting my best stories is my landlord is the head of security for the health region here in Regina. Oh, wow. And he's got like crazy stories.
Oh, geez.
Because you can imagine people being a little wound up right now, and security being, telling people they can't come in, and and
you're like, well, I can't die.
Stealing supplies, and it's bananas. So.
Ugh. Yeah, like even when I go to when I do the click and collect at the grocery store, like even that interaction, it's so minor, is like it's stressful. It's just stressful, like for everybody, and like I feel bad. They see me in a mask and they're like, "Are you supposed to be quarantined?" I'm like, "No, everyone should wear a mask." That's all I say to them. No, you should be wearing a mask too. I'm like I'm wearing a mask because everybody should be, not because I'm quarantined.
Well, you won't be asked anymore. Like there's say half people in the grocery store now are wearing masks.
Yeah, it's more and more. The last click and collect I did, there was a lot more people.
Yeah.
However, the guy who brought my groceries out was not being super careful with everything. He was kind of like standing there, and I'm like looking at him like, "Can you move now?" kind of thing.
Yeah, they're weird.
Yeah, just like. Anyways, so this is a message. Do you have a message for others or for yourself in the future? So this is a message that after the pandemic's over, that you're gonna give to yourself or other people. Any message. It's a time capsule. It's a time capsule on YouTube and other platforms.
I guess my message would be a reminder to be grateful for the normalcy that you have, like for the life that you have, for the ability to go to work, to go to school, to, go to the grocery store without fear, to go on a trip, to see family, to see friends, to go for supper, all of those things that we can't do right now. So like, don't take that stuff for granted. Like, we all get wrapped up in things, and, things aren't as we want them to be. But be grateful for, hey, at least it's not pandemic levels, or, if you're able to go out and live and have some sense of normalcy, and just be grateful for that.
No, that's great. That's a great message, because I hope we don't forget some of those feelings we're having right now. Right. Like I feel like we could. I mean, humans are definitely good at forgetting how they felt and struggled, but
I don't think the average person will forget. I mean, you talk to, history, people who went through the Blitz in World War II in England or whatever, they would talk all their lives about, that experience and what that was like. And
that's true.
I don't think this is something we'll forget. Our kids won't forget this. I don't think.
Definitely not. Yeah.
I think it's not going to kill them, but it'll be something they tell their kids about, I think.
Mm-hmm. Well, that's a great way to end. Great way to end. Anyway, we'll chat a bit after I hit stop here, but
okay.
But I just want to thank you again for being on the podcast, and geez, this is my first time as a host, and I appreciate you being here for that. Hopefully there'll be, well, you know what? I think if I keep doing this and this goes on long enough, maybe I'll have you back on later and kind of see where things are at.
If I'm the most demanded guest, probably. I mean,
you might be.
Your listeners are going to demand this.
They're like, oh, it's that person from that other podcast. What was it called? No, I'm just kidding.
When he talks like way too effing much. Like,
oh man, yeah. Some of the people who used to comment on those things were wonderful.
Well, they weren't wrong. I talk a lot.
No. But why listen to a podcast if you're not going to?
Right.
Don't want people to talk.
Awkward silences are bad in podcasts.
Yeah, exactly.
Very
right.
True.
So, anyways, cool. So, we're going to cut it off here, and thanks again. Bye-bye, everyone.
Bye.